Good afternoon, everyone. So the topic today I have is MNRF versus CO2 for skin rejuvenation, how to choose it. So skin dullness and laxity is a very common problem which is faced by many people in late 30s, and recently there have been increasing public concern thanks to the social media. And response to this, various treatment including the peels, dermabrasion, chemical peels, and energy-based device have been introduced. Now, what are the causes of dullness? It can be intrinsic and extrinsic, environmental, genetic, your diet, stress, pollution, alcohol, cigarette. Now, rejuvenation is a technique. It's a technique of rejuvenation have been developed over the period of time, and these tools primarily focus on the superficial layer of the skin. Now, they are ablative and non-ablative laser, which achieve skin rejuvenation by the removal, contraction, and remodeling of the epidermis and dermis. Now, the main role is structuring the collagen. Collagen is a protein that can help to keep the skin looking smooth, and as the age and other factors reduces the collagen level, the skin loses its elasticity and further the superficial wrinkles are formed. Skin rejuvenation through any means, it is related to the collagen level of the skin, naturally or through aesthetic treatment, which are the means of rejuvenation. One can go for oral supplements, derma filler with hyaluronic acid, vitamin C supplements, antioxidants in your diet, retinoids, oral or topical form, red light therapy, energy-based devices. Now, these are the different methods of rejuvenation. We all have been trying derma roller, energy-based device, your fillers, some medifacials also. Now, collagen concentration in the skin is directly proportionate to the rejuvenation of your skin. So our aim is to build new collagen or remodel the existing one. So what do you mean by rejuvenation by the laser? The laser resurfaces, reduces the appearance of the mild wrinkles and scars. And the laser for the rejuvenation, as I discussed, can be ablative, non-ablative, and the fractional one. Ablative removes the outer layer of the skin, giving you the fresh, rejuvenated beneath skin, whereas a non-ablative one induces coagulation within the skin to stimulate the collagen production, but it does not harm your skin surface. Now, ablative, as the picture shows, it destroys the epidermis and heats the dermis to the surface to rejuvenate. And the side effects are prolonged erythema, infection, and PIH. And the non-ablative one spares your epidermis through cooling, but still allows the healing and denaturization of the dermis protein, including the collagen, and stimulates and tighten up your skin. Now, the resurface is a process where energy is generated at a specific wavelength, which is used to ablate the most superficial part of the skin, and this process can be total or in portion. Now, there are few terms which one should be know. There's something called as a full field ablation, where the whole area is gone. Non-ablative laser, where we see the heat going to a specific area. Fractional ablative, where we see the section completely destroyed. Non-ablative fractional, the sections are heated. Now, how to choose, which is a main topic, MNRF versus CO2. CO2 has been there since 1960, and it was initially used for the cutting and the destruction of the tissue, and it has evolved over the period of time since 1990, and resulting in a high-energy pulse laser that ablates the tissue at a specific depth. And further, in 2004, fractional treatment was evolved. Now, the splitting of the laser beam into a larger number of the microbeams is something we called as a fraction. That means a fraction of the laser is usually given to achieve the results, and the column of ablation through skin is surrounded by the normal and undamaged tissue. It provides an improved side effect profile compared with non-fractional treatment, particularly with respect to avoid dyspigmentation, and it emits energy with a peak wavelength of 10600 nm, which is absorbed by intracellular water. Absorption of this wavelength by the epidermis ablates the superficial aspect, promotes reepithelialization from residual skin epidermis and adnexal structure in the dermis, and the thermal injury that occurs below the zone of the ablation. It induces further heat-mediated contraction of the collagen and subsequent remodeling of the dermis. So here we only playing around the collagen. The contraction of the collagen fiber in turn tighten up the skin. Compared to the other lasers, CO2 generates more heat, causes greater coagulation of the blood vessels and dermis post-ablation. So this is what a picture is like. We can see how it promotes the production of the collagen and increase elasticity and tissue regeneration. Now, this technique is both effective for cosmetic and medical application, and it's an excellent modality for the treatment and preventing wrinkle and skin laxity that occurs with photoaging. MNRF, the amalgamation of microneedling with radiofrequency has expanded the prospects of application of microneedling in aesthetic practice. These are insulated needles which are used to penetrate the skin, release the RF currents from the needle tip, reducing the thermal zone, and further, it helps to prevent the damage of your overlying epidermis. There is a trigger of long-term dermal remodeling, neoelastogenesis, neocollagenesis, and the depth can be adjusted from 0.5 mm to 3.5 mm, allowing us to target different layers of the dermis. Now, the needles make a perfect contact with the skin, smoothly penetrates, and bipolar RF energies denaturizes the tissue surrounding the microneedles, and the collagen regeneration and the new elastin production begins. It's cost-effective, well-tolerated, cosmetically and therapeutic, more beneficial. Needle penetrates the stratum cornea, creating a very small holes, which are called as a microconduits with minimal damage to the epidermis. That's how the energy is delivered to tightly focus at the tip of the microneedles. So it's also called as a collagen regeneration technology, which basically release growth factors like TGF-alpha, beta, platelet-derived growth factor, PGDF, which ultimately results in deposition of collagen by fibroblast. It gives a youthful look with generation of new collagen and is considered to be best for the people with a darker skin type also. So how to compare? MNRF, neocollagenesis, collagen remodeling without damaging epidermis, often used as a substitute for lesser treatment, darkened phenotype, less of PIH. Whereas CO2, we create column of heated in the fractional form of CO2 while leaving the surrounding epidermis, surrounding dermal tissue, fractional photothermolysis causing damage to epidermis. Well, the microthermal zones at a specific depth in the skin, better for the skin type 1 and 2, has a longer downtime. Rejuvenation for CO2, because the CO2 light emits at a specific wavelength, prompts the skin to regenerate skin and collagen synthesis, whereas MNRF, they are microconduits which are formed due to the reorganization of the old collagen fibers and lay down the new collagen. These are the picture. This is post CO2. They are the few pictures of before and after multiple session of this is by MNRF, this is by CO2, but how should we choose? Is your patient ready to take this downtime? The detailed counseling of the patient is very important when you choose which technology you want to choose for the rejuvenation. Technology-wise, both have different set. MNRF energy is delivered through microneedles, whereas in CO2, the energy creates microcolumns of damage to promote the collagen synthesis. Well, MNRF, the depth can be 3 to 4 mm. In CO2, 100 to 1500 microns can be adjusted. MNRF for mild acne scars, mild wrinkles, stretch marks, whereas somebody having deep wrinkles, deep acne scars, sun-damaged skin, one can go for CO2. 1 to 2 days or mild to moderate is downtime and pain level, whereas it's little higher as compared to CO2. There is mild bruising is an extreme kind of side effect one can see in MNRF, but in CO2, scabbing, peeling, and PIH and hypopigmentation can be observed, so detailed counseling is important. In number of sessions, MNRF needs more, 3 to 6, 4 to 6 weeks apart, whereas CO2 typically 1 to 3 sessions, 6 to 8 weeks apart. Shorter recovery time, suitable for all skin type, whereas in CO2, you have longer recovery time, and it's better for the lighter skin type, can be used in all, but has to be used with cautious. Result is gradual, all right, wherein CO2 results are visible quite quickly in 1 to 2 weeks only. Now, cost effectively, MNR is less expensive, but CO2 more expensive due to higher technology and recovery time. Can be performed, MNRF can be performed more frequently, but in CO2, one needs to space them out due to longer downtime. So what I would again conclude is somebody's type 4, MNRF, type 2, both our technology can be used. Patient complaining of wider pores, CO2, mild rejuvenation, MNRF. Patient having old acne existing scars, CO2 would be a preferred one. Patient not willing for any downtime, MNRF. Although there is 1 to 2 days downtime still there. Patient just having superficial wrinkles, both can be used. Patient having deep wrinkles, CO2 should be used. Patient having atrophic scars, acne scars, CO2. Having keloidal
Dr.
tendencies.
Pallavi, we are running out of time.
MNRF, tendency for PIH, MNRF, photo 8 skin is CO2. So again, choose wisely. There are certain things, it has been concluded, both are equally safe, but it's MNRF, which is safer, is CO2, which is more intense and has a deeper downtime. Combination therapy of both the treatments is worth trying once you know the technology deep, because fractional lasers are effective in treating superficial texture irregularity with a color variation also. Look in the account of skin type, tolerability of the patient, safety profile, patient medical history, tendency for scarring, and patient treatment expectation. This is how we perform MNRF, and it depends on the patient demographic thing also. Better for MNRF, better for the darker skin type, more effective, more tolerability, relatively safer, whereas CO2 demonstrates greater efficacy with the patient having atrophic scars. Now, both are equally good for the rejuvenation, but you need to tailor your treatment according to the patient requirement. A dermatologist must seek guidance while selecting the appropriate treatment approach for each individuals, ensuring the best possible results. Have a group of your friends who are dermat. Tailor your treatment like I do, as I have very good friends who are dermats. So that's how you'll understand the individual character of a skin. And thank you so much. It's an honor for me to invite you all for this esteemed conference of FATS Goa, which is 13th to 15th of November at Goa, India, and you all are welcome for that. Thank you so much.